I want you to do something right now before we say another word. Put two fingers on the inside of your wrist, just below the base of your thumb. Feel that pulse, that rhythmic pressure pushing against your fingertips. That is your heart beating. And every single time it beats, it is generating a wave of pressure that travels through every artery in your body. When that pressure is too high, when the force is too great for the arterial walls to absorb comfortably, it is quietly, methodically, silently tearing up the inside of those vessels, your brain, your heart, your kidneys, your eyes, every beat, every day, all day long. And most people over 60 with high blood pressure feel absolutely nothing. My name is Dr. James Mercer. I am a board certified physician with 35 years of clinical practice and over 40,000 patients treated. I have spent more time than I can count explaining to patients why hypertension is called the silent killer and watching the information fail to feel real enough to change anything. Today, I am going to do something different. Today, I am going to give you a specific morning protocol built on peer reviewed cardiovascular science that multiple clinical studies confirm can produce a measurable drop in blood pressure within 5 to 7 days of consistent practice. No prescription, no pharmacy, nothing you need to buy, just 5 minutes of your morning starting tomorrow. Before I give you the protocol, I need you to understand something about your blood pressure that most doctors never explain clearly enough. And it starts with a number that you may have seen on a medical report or a home monitor without fully understanding what it means. Your blood pressure reading has two numbers. The top number, the systolic pressure, is the force your heart generates during each contraction as it pushes blood out into the arterial system. The bottom number, the diastolic pressure, is the residual pressure in your arteries between heartbeats when the heart is relaxing and refilling. When your doctor or the machine at the pharmacy says your blood pressure is 145 over 92, that top number means your heart is pushing blood with a force that generates 145 millimeters of mercury pressure in your arteries with every beat, every single beat, roughly 100,000 times per day. Here is why the top number matters so much after 60. The arterial walls of the aging body have undergone decades of cumulative change. The elastin fibers that make young arteries stretch and recoil with each heartbeat, absorbing the pressure wave like a spring, progressively stiffen and fracture with age. The arterial wall becomes less compliant, less elastic. When a pressure wave hits a stiff, inelastic arterial wall, instead of being absorbed, it is reflected back. That reflected pressure wave adds to the next heartbeat's pressure wave. The systolic number climbs, and a stiff artery that cannot adequately buffer the systolic spike is an artery whose inner lining, the endothelium, is being mechanically traumatized with every heartbeat. This is the biology of isolated systolic hypertension, the most common form of high blood pressure in people over 60. And the 2025 joint guidelines from the American Heart Association and American College of Cardiology, and the most comprehensive update to hypertension management guidance in nearly a decade, define high blood pressure as a systolic reading of 130 or above, not 140, not 150, 130. Under the current guidelines, approximately half of all American adults meet the definition of hypertension. Among adults over 60, the prevalence is higher still. Now, here is what drives me in this conversation. The standard clinical response to that diagnosis is a medication: ACE inhibitors, calcium channel blockers, beta blockers, diuretics. These medications work for many patients. I prescribe them. I am not anti medication, but here is what the same 2025 AHA and ACC guidelines also state: that lifestyle interventions are the foundation of hypertension management and should be implemented in every patient, regardless of whether medication is also prescribed. And the specific lifestyle interventions with the strongest blood pressure reducing evidence, including interventions that produce results within days rather than months, are almost never explained to patients in the depth they deserve. That changes right now. I am going to walk you through a 5 step morning protocol. Each step has direct clinical evidence behind it. Each step addresses blood pressure through a different mechanism, and together practice consistently every single morning, they create a cumulative compounding cardiovascular effect that can drop your systolic blood pressure by 5 to 15 millimeters of mercury within 5 to 10 days. That range, 5 to 15 points, is comparable to what a first line antihypertensive medication achieves in many patients without a prescription, without side effects, without cost. The first step is isometric hand grip training. And I want you to pay very close attention to this one because it is the most surprising and the most powerfully evidenced natural blood pressure intervention I have encountered in 35 years of practice. Isometric exercise means muscle contraction without movement. You squeeze something, you hold it, you release. And the cardiovascular effect of this specific type of muscular effort is completely different from the effect of aerobic exercise or traditional weight training. Here is the biology. When you perform an isometric hand grip contraction, squeezing as hard as you can and holding for a count of 60 to 120 seconds, the muscle fibers in your forearm generate tension without moving. During that sustained contraction, blood flow through the muscle is partially occluded. Oxygen delivery decreases. The muscle begins to produce metabolic byproducts. When you release the contraction, blood flow surges back into the muscle with dramatically increased velocity. That surge of returning blood creates shear stress on the inner lining of the blood vessels supplying the forearm. And shear stress is the primary physiological trigger for the endothelium to release nitric oxide. Nitric oxide is the most potent natural vasodilator in the human body. When the endothelium releases nitric oxide into the arterial wall, the smooth muscle surrounding the artery relaxes, the artery dilates, the resistance to blood flow decreases, blood pressure falls, and importantly, the research shows that this nitric oxide driven vasodilation is not just local, it is systemic. The isometric hand grip exercise you perform with one hand generates a cardiovascular signal that reduces peripheral vascular resistance throughout the entire arterial network. A randomized controlled trial published in PLOS One in 2025 examining home-based isometric hand grip exercise in older adults with hypertension found that only the group performing isometric hand grip training showed a significant reduction in blood pressure compared to controls. A systematic review and meta-analysis published in the Journal of Cardiopulmonary Rehabilitation and Prevention in 2024 examined the effects of isometric hand grip training on ambulatory blood pressure across multiple studies and confirmed significant reductions in systolic blood pressure. Multiple earlier reviews, including one that compared isometric hand grip training directly to endurance exercise and dynamic resistance training, found that isometric hand grip training was superior to both in reducing systolic blood pressure, with average reductions ranging from 5 to nearly 11 millimeters of mercury, depending on training duration and baseline blood pressure. Here is the exact protocol. Find a tennis ball, a thick rolled up towel, or any grip tool that provides meaningful resistance. Squeeze it as hard as you can. Hold the contraction for 60 seconds. Release for 90 seconds. Repeat 3 more times for a total of 4 contractions. Then switch hands and repeat the entire sequence. Total time, approximately 12 minutes. Do this 5 days per week. Research has confirmed that the blood pressure benefit begins to appear within the first week of consistent practice and continues to improve over 4 to 8 weeks. After the first 5 days, measure your blood pressure at the same time of day as you do now. What you find may genuinely surprise you. The second step is slow diaphragmatic breathing, and this one can be done immediately after your hand grip training, still seated before you even stand up. Here is the physiology. Blood pressure is controlled by a system in your nervous system called the autonomic nervous system. The autonomic nervous system has 2 branches. The sympathetic branch, your fight or flight system, raises blood pressure, increases heart rate, constricts blood vessels. The parasympathetic branch, your rest and digest system, lowers blood pressure, slows heart rate, dilates blood vessels. In most people with hypertension, and particularly in older adults who carry years of accumulated stress, poor sleep, and elevated baseline cortisol, The sympathetic branch is chronically dominant. The accelerator is pressed more than the brake. Slow, deep diaphragmatic breathing at a rate of 5 to 6 breaths per minute, which means an inhale of about 5 seconds and an exhale of 5 to 6 seconds, is one of the most efficient ways to manually shift the autonomic nervous system toward parasympathetic dominance. Here is why. The vagus nerve, the longest cranial nerve in the body and the primary highway of the parasympathetic nervous system, runs directly alongside the descending aorta and major vessels. Diaphragmatic breathing creates pressure changes in the chest cavity that directly stimulate the vagus nerve with each breath cycle. Slow breathing at 6 cycles per minute has been shown in multiple published studies to maximize what cardiologists call baroreflex sensitivity, the sensitivity of the pressure sensing feedback mechanism in the carotid artery that regulates blood pressure moment to moment. A more sensitive baroreflex means the system detects and corrects blood pressure spikes faster. A systematic review and meta-analysis of clinical trials examining device-guided and non-device-guided slow breathing found that slow breathing at 6 cycles per minute produced significant reductions in both systolic and diastolic blood pressure across multiple study populations. A study published in Hypertension, the flagship journal of the American Heart Association, specifically showed that slow breathing at 6 cycles per minute significantly improved baroreflex sensitivity and decreased blood pressure in patients with essential hypertension. A 2025 study from Vanderbilt University Medical Center examining 12 weeks of yoga-based slow breathing exercises confirmed clinically significant blood pressure reductions in people with elevated baseline pressure. For your morning protocol, after your hand grip training, sit quietly in a chair with your back straight. Place one hand on your belly. Breathe in through your nose for a count of 5, allowing your belly to rise rather than your chest. That is what makes it diaphragmatic rather than chest breathing. Hold at the top for 1 count. Breathe out through your mouth for a count of 6, allowing your belly to fall. Repeat for 5 minutes. 12 cycles per minute is too fast. Aim for 6 cycles, set a timer, and commit to 5 uninterrupted minutes every single morning. This is not meditation in the abstract sense. This is a physiological intervention with documented antihypertensive effect rooted in vagal nerve activation and baroreflex sensitization. The third step of the morning protocol is the one that will surprise you the most, and it requires nothing more than stepping outside your front door for 10 minutes. Morning sunlight exposure, and I am going to tell you a mechanism that most cardiologists have never explained to their patients because it was not well understood until relatively recently. Within the first hour after sunrise, sunlight contains a disproportionately high ratio of red and near infrared wavelengths relative to the UV content. These long wave frequencies of light penetrate the skin and reach the subcutaneous blood vessels. And when they do, they stimulate the production of nitric oxide from nitric oxide stored in the skin and subcutaneous tissue in a form called nitric oxide precursors. That nitric oxide enters the circulation and produces immediate systemic vasodilation. Research from the University of Edinburgh, published in the Journal of Investigative Dermatology, demonstrated that UV exposure to the skin causes a rapid release of nitric oxide from skin stores into the bloodstream, sufficient to produce a measurable reduction in blood pressure. The effect is acute and appears within minutes of sun exposure. Multiple studies examining populations with greater sun exposure consistently show lower average blood pressure and lower cardiovascular mortality, and research has proposed the skin nitric oxide pathway as one contributing mechanism alongside the vitamin D synthesis effect of sunlight. For someone over 60 whose endothelial nitric oxide production is already reduced by the aging process, using the morning to deliberately expose the skin of the arms and face to natural morning sunlight is a free, practical way to supplement the body's declining endogenous nitric oxide supply 10 minutes of morning sun exposure on bare skin, arms, and face uncovered within the first hour after sunrise. This is step 3 of your morning protocol. Combine it with a slow walk outside if possible, which adds the blood pressure benefit of gentle aerobic movement through the mechanism of increased cardiac output and vascular shear stress. The fourth step is a single dietary decision that I want you to make every morning, and it concerns what you drink first. Before coffee, before tea, before breakfast, drink 500 milliliters of plain water, roughly 17 ounces, immediately upon waking. Here is the cardiovascular biology behind this specific recommendation. During sleep, the body undergoes a mild degree of dehydration from respiratory water loss and sweating. Even mild dehydration increases blood viscosity, the thickness of the blood. Thicker blood creates more resistance in the vessels. More resistance means higher blood pressure to push the same volume through. Research has specifically documented that morning blood pressure is highest in the first hour after waking, a phenomenon called the morning blood pressure surge, and that dehydration is one of the contributing factors to that surge. Drinking 500 milliliters of water upon waking reduces blood viscosity. It expands plasma volume. It reduces the cardiovascular resistance that contributes to the morning surge. It also activates a reflex called the sympatho-inhibitory reflex through the stretching of the stomach wall, which measurably suppresses sympathetic nervous system activity in the minutes following. This combination of reduced viscosity and sympatho-inhibition contributes to a lower baseline pressure for the first hours of your day. After that water, and this is where the dietary specificity matters enormously, eat a potassium-rich breakfast. Potassium and sodium operate in a direct physiological opposition inside the kidney. Sodium signals the kidney to retain water, expanding blood volume and raising blood pressure. Potassium signals the kidney to excrete sodium, and with it, water, reducing blood volume and lowering blood pressure. The ratio of dietary potassium to sodium is, according to growing consensus in cardiovascular nutrition research, more predictive of blood pressure outcomes than either mineral in isolation. A breakfast built around potassium-rich foods, one banana, a serving of plain Greek yogurt, a handful of spinach or avocado with eggs, delivers a potassium payload that begins shifting the kidney's sodium-water balance within hours. The 2025 AHA and ACC hypertension guidelines specifically identify dietary potassium as a key lifestyle intervention for blood pressure reduction. The target is 3,500 to 5,000 milligrams of potassium per day. Most American seniors get roughly half that. The gap between what they consume and what they need is doing measurable cardiovascular harm every single day. The fifth step is the one that connects everything else together and amplifies every other intervention in the protocol. And it happens at a specific moment in your morning that most people completely waste. The 5 minutes immediately after you wake up and before you look at any screen, no phone, no news, no social media, no email. I want those 5 minutes to be what I call vascular silence time. And here is why this matters more than it sounds. Cortisol, your primary stress hormone, naturally peaks within 30 to 45 minutes of waking in a phenomenon called the cortisol awakening response. This is normal biology. A moderate cortisol awakening response is healthy and helps you achieve daytime alertness. But in someone who immediately reaches for their phone, who within the first 2 minutes of consciousness is reading breaking news, checking messages, scrolling through social conflict on social media, the cortisol awakening response is amplified. The sympathetic nervous system activates before the body has had a chance to complete its natural transition from sleep physiology to waking physiology. Blood pressure spikes earlier and higher. Vascular tone increases before breakfast, before movement, before anything. Research on morning cortisol amplification and cardiovascular health has consistently documented that the quality of the first 30 minutes after waking has a disproportionate influence on inflammatory markers and cardiovascular tone for the rest of the day. The morning stress response sets the physiological baseline. If that baseline is elevated by stress activation before you have left your bed, everything that follows is fighting uphill. Vascular silence time, like 5 minutes of quiet sitting, slow breathing, or simply looking out a window without any screen input, allows the cortisol awakening response to complete its natural arc without amplification. Your sympathetic nervous system begins the day at a calmer baseline. Your blood pressure starts from a lower floor, and every other intervention in this protocol works more effectively because the nervous system is not already activated against them. Now, let me tell you something I want every person over 60 with high blood pressure to hear, and I am saying this from 35 years of watching the system manage this disease. High blood pressure generates enormous pharmaceutical revenue. Antihypertensive medications are among the most widely prescribed drugs in America and among the most profitable. The standard clinical pathway for a patient presenting with a systolic of 145 is measure it twice, confirm the reading, prescribe a medication, schedule a follow up in 90 days to check if the medication is working. That pathway is not wrong. Medications save lives. But what is missing from that pathway almost universally is an honest, thorough, specific explanation of the lifestyle protocol that the research shows can achieve comparable blood pressure reductions without a prescription. A randomized controlled trial protocol specifically examining isometric handgrip training in older hypertensive adults found that IHG training in a review was superior to endurance training in reducing systolic blood pressure by 10.9 millimeters of mercury on average. Most first line antihypertensive medications reduce systolic pressure by 5 to 10 millimeters of mercury in the first weeks of treatment. We are not talking about a marginal natural effect. We are talking about a clinically meaningful reduction documented in peer reviewed cardiovascular literature, achievable with a tennis ball squeezed in your living room every morning. The slow breathing protocol at 6 cycles per minute for 5 minutes daily has been shown in meta-analyses to reduce systolic blood pressure significantly. Dietary potassium in amounts achievable through food alone has been shown to reduce systolic blood pressure by 4 to 5 millimeters of mercury on average across study populations. Morning hydration reduces the viscosity driven component of the morning blood pressure surge. Morning sunlight supplements the declining endothelial nitric oxide production of the aging vascular system. Combined, these five interventions address five separate mechanisms of blood pressure elevation simultaneously, and not one of them costs a dollar, requires a prescription, or carries a side effect profile. The reason they are not the first conversation in most hypertension appointments is not that they are less effective than what is being prescribed. It is that the appointment is 15 minutes long and the prescription takes 30 seconds to write. Now, let me walk you through three futures. In the first future, you already have a blood pressure medication you have been taking for years, or you have a reading that has been creeping up, but you have not been prescribed anything yet. Either way, you hear this today and decide the routine sounds like too much to add. Tomorrow morning, you wake up and reach for your phone. You skip the water, you skip the hand grip, you skip the breathing. The morning cortisol surge runs its course unchecked. The blood pressure reading this evening is what it always is. Next month, it is what it always is. Next year, the arterial wall that has been absorbing that pressure for decades continues absorbing it, stiffening further, narrowing the margin between where you are now and the event that the pressure has been building toward. In the second future, you do part of the protocol. The breathing feels manageable. You try it a few mornings, you see a small improvement on your home monitor and feel encouraged. But the hand grip training feels unfamiliar and you skip it. The sunlight exposure happens when it is convenient and not when it is specifically morning. The potassium rich breakfast happens 3 days out of 7. Partial commitment yields partial results. The blood pressure improves modestly, but the full compounding effect of all five mechanisms working simultaneously never materializes. In the third future, tomorrow morning, you set your alarm 5 minutes earlier than usual. You drink your 500 milliliters of water before anything else. You sit quietly for 5 minutes without a screen. You take your hand grip tool and complete 4 contractions per hand. You do your 5 minutes of slow breathing at 6 cycles per minute. You step outside for 10 minutes of morning light on bare skin. You eat your potassium rich breakfast. You repeat this every morning for 5 days. On day 5, you take your blood pressure at the same time you took it before you started. And what you see on that screen and the number that represents the pressure bearing against your arterial walls is lower than it was before. Maybe 5 points lower, maybe eight, maybe more. And for the first time in a long time, you have a sense that this disease is something you have real influence over, not just something being managed by a pill. That third future is 5 minutes of your morning, and it starts tomorrow. Here is my direct medical opinion. Hypertension is not a disease you are supposed to simply accept and medicate without understanding. It is a disease with lifestyle drivers and lifestyle solutions that are documented in peer reviewed cardiovascular science. You deserve to know those solutions with the same specificity that a cardiologist understands them. You deserve to be given the tennis ball before you are handed the prescription. And you deserve a doctor who tells you that squeezing that ball every morning, combined with breathing sunlight, water, and potassium, may do more for your arterial health than the pill you have been taking for 3 years. Before you go today, I want your answer in the comments. What is your current systolic blood pressure reading? And has any doctor ever described the hand grip or breathing protocol to you before today? Tell me below. I read every single comment, and your answers shape what comes next on this channel. If this gave you something genuinely important today, subscribe right now. Every week, I come back with the honest cardiovascular medicine that seniors deserve to have in their hands. Next week, I am going to reveal a specific number on your blood pressure reading that your doctor checks and almost never explains correctly, and how misunderstanding that number is causing millions of seniors over 65 to be undertreated or overtreated in ways that are silently costing them their cardiovascular health. You will not want to miss that one. I am Dr. James Mercer. Take care of that heart. 5 minutes tomorrow morning. I will see you next week.